I know. I have my water too. Okay.
I've never had a coughing fit or anything during these, but I'm like, one of them I am.
I know. I thought about that today.
Oh, we are live. Hello, everyone. My name is Brienne. I'm here with Kind, one of the lactation providers here. And tonight we are going to be talking about tongue ties, lip ties, and all tie additions. So we have joining us Dr. Rachel Paulson. Hi, Dr. Paulson.
Hello, everyone.
Thank you for joining us tonight. So just kind of a quick introduction on Dr. Paulson. She is a general dentist practicing in Mishawaka.
You got it.
Yay, Indiana, and the owner of Princess City Dental Care. She's graduated from Indiana University School of Dentistry in 2009, and then from the University of Florida, go Gators,
Yay.
in 2010, receiving an AEG residency certificate. Among many interests, Dr. Paulson has a passion for helping breastfeeding mothers, and she has breastfed 3 children of her own, one who is actually tongue-tied, and that kind of has driven her passion for continuing education in the area of oral restrictions and their effects. She's been evaluating, diagnosing, and releasing oral restrictions since 2015. Dr. Paulson is a member of the International Affiliation of Tongue-Tied Professionals and was named one of the Michigan? Michiana, sorry. Top 40 professionals under 40 in 2016. So thank you so much for joining us and taking the time to be a part of our show tonight, helping moms just really kind of understand ties and how it affects babies and them personally, and helping get it corrected if need be.
Yeah, no, it's a pleasure here. Thank you for asking me. I look forward to, taking any questions, providing some information, and hopefully I can be some help.
Awesome. Now, can you kind of tell us a little bit, I guess, how you got into it? I know, so your daughter, right, had some issues?
Yes, and actually she wasn't one of the reasons that I actually got into it. I just happened to discover that she did have TIE when starting the journey. And so I had been a member or going to the Leche League meetings since my first was born for a long time. And the lactation consultant that supported me with the birth of all my children just asked, found out I was a dentist, hey, do you release tongue ties? And I said, well, on adults. I'm like, what do you mean? She goes, no, on babies. I said, well, I get some information. And that's my journey of trying to learn and finding a place to learn about it, because it seemed like there was a need, especially for a breastfeeding mom would be a good person to help provide that service. And so in the journey with my daughter just being born, realized she had a tongue tie and a lip tie. And I ended up revising. I found a very generous dentist in Dayton, Ohio, Dr. Greg Notstein, and he provided me with information and a day in his office to learn from him. And that's where my journey of learning and training began. So he helped me through FaceTime and actually guide me through revising my daughter's time. And then it just took off from there. And here we are today. And so taken a lot of courses and done a lot of training and just a lot of learning and experience in my own office. So.
Awesome. Yeah, that is, I've had both, with my 2 boys, one that we corrected and one that we didn't, and kind of both their journeys of the ups and downs. And so it's interesting how I always kind of joke as a lactation provider, I was given everything that could happen in lactation. I was given it through my 2 sons just so I could tell moms I experienced it. Thanks universe for that one. But no, it definitely sometimes our own experiences can really help us when we're helping moms and drive that passion.
Absolutely. So, there's nothing better than empathy when you've lived it yourself. And
exactly.
You can have a lot of empathy for moms and babies.
For sure. So let's talk, what is a tie? So can you kind of hit on, what if you have no idea what we're talking about? Like a bow tie, or what are we talking about here?
Right. So a lot of parents will come in and be like, my lactation consultant or my midwife said my baby has a tie. I really have no idea what I'm looking for. I think lip ties are really easy to see, and because they're just out in front, and so be like, I see that thing under their lip, and they really don't know what they're looking for. I always say you have to get your fingers to look under the tongue, otherwise you really see. And something to see, you know, see what they're looking for. We'll be able to see a tether or tissue under the tongue or the lip that's restricting movement of the tongue and the lip. And there's nothing really, I mean, a picture of an obvious tie is there, but a really thorough evaluation is what's needed. How would any tissue under the tongue or the lip affect function? And so, a really good place to start are some basic pictures. I refer people to Dr. Gahari's website and to Dr. Cotwell's website for just some basic pictures of what is a tie, what are the grades. It's a good place to start.
Awesome. Yeah. And so, ultimately, a lot of times the moms usually start asking the questions when they start having a bunch of signs and symptoms, right? So we have painful latch, transfer issues, weight issues, sometimes mimicking reflux or colic, mastitis, lots of clicking,
Yep.
milk dribbling, that lip really tucked under, the seal just continually breaking every time the baby latches.
Mm-hmm.
And so, in my experience in the lactation world, a lot of moms, I think on our side really say, oh, I never thought it was a tie because my baby didn't have all of these. Or my baby was gaining weight fine, so I thought it was okay. Or I didn't have that much pain, so I thought it was okay. And
Yeah.
so ultimately, I think it's really helping moms to understand, one, having that lactation provider evaluation, as well as, with a provider for release as well. But really just getting, on the lactation side, talking through those symptoms, mastitis, clogged ducts, seeing if there's a other root problem. If you've ruled out everything else, then that's when, as a lactation provider, I would refer to you for a full oral eval to see, are these ties then the root cause of these issues?
Yeah, absolutely. I never say I don't have an hour to spend with moms, and that's why a thorough evaluation by IBCLC first would be really important for those reasons you're describing. The symptoms that are caused by ties can be caused by a whole number of, and only an IBCLC is really thoroughly trained to know what to rule out and what's really the cause. And if you've ruled out everything else and you suspect the ties are causing these symptoms, then right, refer them to a provider for an evaluation. Yep.
Yeah, exactly. So, again, just, if the what, these sound like your baby, again, you're having transfer issues, painful latch, the fussy, kind of colicky, they're really ultimately getting, potentially a lot of air in as they're not able to really create that seal, whether it's the tongue or the lip or even both. So when that's occurring, there can be a lot of these issues that the dribbling of milk. And so definitely getting in first, probably with lactation, IBCLC, CLC, to see kind of full eval, see what's going on. But there could be hope. I mean, I see so many moms where, and even they'll have a 6-week-old and they had an oversupply in the beginning. So the baby got enough and maybe they had a high pain tolerance. So they just kind of brushed it off. And now their supplies leveled out and now they're having issues, so it doesn't have to be like a brand new 2-day-old baby that could have issues.
Yeah.
Sometimes it's even later on in the journey that the issues start to arise.
Yep. I see it all the time. And, everyone says, and I think one of the questions people ask ahead of time is, when is the right time? I don't think there's ever a wrong time. I've seen, babies that are just barely over a day old when it's obvious that there's problems, but you're right, symptoms can arise later and really sooner the better. But, there's no wrong time. There's no wrong time to revise if it's needed.
For sure. Yeah. One of our followers had asked that. So yeah, thanks for addressing that.
Yep.
Um, what else? So do you feel there's been, another question that got asked, a rise in, you know, ties in general. Some people say, "Oh, it's just become it's a fad right now, and it'll grow out. We've never heard of this before." What are your thoughts on kind of increase in numbers? Do you feel it's always been the same? What are your thoughts?
So what I'm going to draw from, I mean, if you're going to really look at research and pull from papers, I mean, real solid information is limited. But if you think that, you know, 3 to 5% of babies have an oral restriction, which is pretty consistent through research. I mean that, I mean hundreds of thousands of babies in your state or in the country every year, and so everyone's affected differently by ties. I think there's more of an awareness now, from courses I've taken and things I've read. Moms want to breastfeed and they want to be successful, and I think in our day and age, especially with social media, they're not taking no or giving up lightly. They're not taking no for an answer. And with IBCLC's awareness there, um, I think there's just more of an awareness. People want to find a solution. And there's a long history of midwives clipping,
Mm-hmm.
tongue-tied newborns, and it's not a new thing, but it's an awareness. I think more providers treat it. Um, and so, especially dentists, pediatricians, midwives will treat it, and uh, that's just why it's getting done more. It's getting assessed, it's getting diagnosed, it's getting treated efficiently and earlier. Um, you have to be just very wise about your assessment and only treat when it's needed.
Correct. Yeah, I was reading that midwives actually, one of the webinars they took too, they brought it up, used to take their fingernails
Yep.
and do like, type 1, class 1, 2 down there. And
Yep.
so, and then we kind of shift over to if you couldn't breastfeed in our country, you just went to bottles. It was just kind of, that's just what you did. If you
Yep.
had a tie, you just switched to bottles. And that was great. And that was okay. But again, like you said, nowadays moms just are really wanting to have a solution. They're really wanting to succeed at the breastfeeding. And
Yep.
so we have access to a lot of research. So they're online. They're like, wait a minute, hold on, I want to breastfeed. There has to be a way I can. And that's when they're coming across, wait, I need to see a lactation provider. I might have a tie. I might need to get it fixed.
Yep.
And like you said, it's just more awareness, and moms really wanting to find that answer. So awesome. So does baby have a tie? We answered that. How does ties affect the breastfed baby? Kind of talked about some. Do you have anything else to add to that?
Yeah, I mean, you had a really good symptom list. When I have my intake form, I'm looking at baby symptoms and so baby symptoms would include not latching well, not staying latched on, popping on and off, chewing and chewing, um, clicking while nursing, um, not transferring milk, low waking, um, uh, they have reflux, really gassy. There's a lot of other things. Those are the main ones. For mom, it's shallow latch, so pain while nursing, mastitis, clogged ducts, thrush. Uh, I even include in there, my intake sheet, like things like postpartum depression, because when nursing's not going well, your baby's really colicky and fussy. It can be really hard, and you have to look at those as a whole, and then rule out another cause. I always tell parents, if you're looking at food illnesses or you know reflux or other things, say babies are entitled to have as many problems as they want, and a tongue tie could be a piece of it,
Mm-hmm.
or it could be all of it, and that's why you have your pediatrician and your BCLC.
Yeah, exactly. And there's really no, someone asks, is there, one kind of sign that's like, up, yeah, baby has it. And I feel with lip and tongue tie, it definitely is a little more intricate on having, really to evaluate both mom and baby dyad to see what's going on with both. There's not just one, like if I look at a mom and up, yep, you have to, your baby's got tongue tie, because it could just really, there needs to be a full evaluation. Um, Now, do you feel it's genetic? Do you feel like it's passed on genetically?
So yes and no. And I read Dr. Baxter's book, and I really liked his summary. It's called Tongue Tied, and I really like his summary on genetics and how ties are formed. And it can very well be a spontaneous mutation, and it can the extra tissue that's under the tongue or under the lip when the baby is formed and the head comes together, it can be extra tissue. It could just be lack of they call it apoptosis, with cells getting rid of extra tissue. Not every tie is formed the same way and caused by the same issue. And
Mm-hmm.
it could be a spontaneous thing. It can be genetic related. Um, and, because you do see ties in families a lot, I see it every day. And whether that's not research, but I see it every day. Mom with the fourth baby, like, I've been here 3 times already. I'm back.
Yeah.
Uh, but uh there's a male predilection, like 3 to 1 males versus
Mm-hmm.
females. And there are some that say that there are a few specific genes that link ties among other issues, and that can be genetically linked or X-linked. So when I read his book, he really gathered a lot of information from a different resources, and absolutely can be genetic and absolutely can be spontaneous. So
Awesome. Yeah. So, thank you. Lacey had kind of asked, was it hereditary? So I guess her husband had one that wasn't fixed as an infant. So she was kind of wanting to know. So hopefully that helps answer her question on that.
yep.
Um, let's see. So we kind of talked about genetic, talking about, before we go into kind of the care or treatment of it and procedure
Mhm.
of it, regarding diagnosis, like in getting it fixed. So a couple of people have
Sure.
asked, like, is it best to get it like in the hospital if you see it right away? Should you just get it done just to avoid what might come? Or, and then is there also, second question's been asked, is there also any delay kind of like for if you don't get it done later in life, like speech, solids, tooth decay, stuff like that? So kind of a two-part question on doing it super early or waiting till like toddlerhood kind of later.
Yeah, absolutely. I don't think there's a right answer. During an evaluation by an a provider, pediatrician, ENT, whoever you go to, it's really important to look at tongue function. Whoever can assess that. Can the tongue elevate and can it get out? And once you know if the tongue physically can do those things or can't do those things, it can maybe give you a clue on what's going to happen. I always say when I'm having a discussion about that, I can't predict. I see tongue ties in adults that are very high functioning. They don't have a speech impediment. They have wide jaws, perfect facial development. And I'll see someone else with a similar tie and they have narrow archways, a narrow airway, have trouble eating food, and have a speech impediment. And so there's no way to feature. There's no way to know. And so if you see that there's a tie under the tongue that is physically restricting the tongue from doing one of those things, either going out or going up or both, um, I always say it's better to treat it early before symptoms come. Because especially I find with new moms, if you go 6 to 8 weeks out just to see if it'll be okay, sometimes there's supply that's lost that can never come back. They just can't get it back. And or latch at the breast and mom's pumping and half bottle and they can't get it back. And who's to predict who that's gonna be? And I think sometimes mom's anatomy and baby's anatomy just make it work. And they thrive to fine. Sometimes they just don't. And you see an obvious restriction, there's no better time than the hospital. If someone was trained to do an adequate release in the hospital, that would be the best time. The effects of ties, then you don't have to fix a bad latch or fix a low transfer or fix muscle tension or torticollis. You don't have to work at making it better if you treat it early.
Yeah. And then with later, what are your,
Yeah. So treating it later, if there's any wrong time. If babies
I
are
guess not treating it? Yeah.
oh, versus not treating it. So, like I said, there's no way to predict if someone's gonna have speech issues or not. But I think a really well trained SLP or someone, maybe say, oh, well, the tongue can't get up, so the chances of them being able to form R's correctly down the road are low. Um,
Mm-hmm.
will you know for sure? No,
Mm-hmm.
not until they're 4 or 5 years old. So do you want to wait that long? I think all you can do is assess and have a pros and cons conversation with the parent and have them make a decision. Say, well, the tongue can't move up this. So what would be the next step? Solid foods. 6 months. Can they swallow solid foods without choking? Then what's the next thing? Talking, and if you get to that point, there is no wrong time to revise. It's just how much work will you have to do to, as far as feeding therapy or speech therapy, if there are problems to fix habits.
Yep. Awesome. So, guys, if you're just joining us, my name again is Brianne with Kiinde. We're here with Dr. Rachel Polson. We're just talking about lip and tongue ties tonight. So, if you have any questions, please comment below. We've kind of been talking about what ties are, when the right time to fix them is, how to know if we have a tie, signs and symptoms when you're breastfeeding to maybe know. And so, stay with us. If you stay with us to the end, we're going to be giving every mom one of our breastfeeding starter packs here where you can pump directly into our storage bags and then pop it right into our bottles and feed directly from it. So every mom will get one of these for free and then just pay $6 shipping. And then we're also be giving away our large gift set at the end to one lucky mom that will go over. So jumping back in, the next kind of thing is, so we're talking, right, the lip tie, where you have this membrane that is attached, holding down kind of the tongue so baby cannot fully, I'm probably going to get the worst picture taken. Someone's going to screenshot me, right? But when your lip cannot fully flange, you cannot create a seal, and there's things that are happening with latch that baby needs to be able to do that. And then the tongue, there's a membrane as well that can sometimes be, tightened or restricted, holding the tongue down. And if the tongue cannot extend, so right, you have a breast right here, if the tongue cannot extend out when you're in that latch position, as well as really move the movement of the tongue to be able to reach, towards that palate, then you're going to have, right, that restriction, and there's going to be, poor transfer or more of like a chomping, which is going to cause like the blanching, the white nipples and stuff like that. So we kind of talked about signs and symptoms. So moving on now, they come to your office. What does kind of, I guess, an evaluation look like with you? And then moving into releasing, what does that look like?
Yeah, I can go through kind of what I talk about with parents when they come in. What I first do is go through who referred them, who they've been working with, and then I go through their, and then after that, I sit knee to knee with mom or dad, and they put the baby on my lap, at least just their head, so I can be behind their head, and so I can lift their tongue and look and lift their lip and see what's going on. But before I just feel their suck. And I had a baby for the first time today, would not suck on my finger, so I can put first time in all these years. But I really need to see how the tongue is moving. Can it, like you said, can it get out and create the bottom seal? Can it get up in the back and transfer milk? Can the lip flange out? And is anything restricted? And I check under the lip. Can the lip get up over the nose, blanching or getting tight? You look at lip blisters. Are they rubbing and getting calluses from tucking their lip under? And then I look at the tongue, even when they cry. Is it bowl shaped? Is it cup shaped? Can they physically get their tongue up or can they not? And I spend a variable amount of time. There's an obvious anterior tie. That's a quick look like, okay, that baby cannot get their tongue out or up, and that's pretty obvious. But sometimes I spend a long time. I really need to assess what's going on with the tongue and the lip. And then after that, I explain to parents that tongue ties are like sailboats. You have a mast and you have a sail. And some babies' tongue ties are just the mast or a thick band of collagen in the back of the tongue that restricts the tongue from going up. A sail can extend anywhere from the middle of the tongue all the way to the tip, and that can restrict the tongue from going out. And releasing that, releasing the whole sailboat, the mast and all. And if you're not able to do that, then you may be leaving some tissue behind where the tongue won't function at its full capacity. It won't get up and it won't get out. Um, and then after we, and yes, there's a restriction or no, there's not. If there is, way I explain the procedure is I have laser. It literally takes away the that's under the tongue and the lip. It takes me about 30 to 40 to release both tongue tie and a lip knot. I usually say collagen, the fibers don't have any nerve or blood in them necessarily, but the surrounding tissues do. So I do place some numbing gel on there. And we swaddle the baby up nice and tight, a little numbing gel release, and then we get back to mom to nurse right away. And number one, that's for comfort. Number two, with the type of laser I have, really low risk of bleeding, but the risk is there. If there's a blood vessel running along in there, it could bleed, but there's nothing better than breast milk and nursing, and it'll stop typically within 1 week. And then I go through pain management ideas, aftercare, but that's how I explain the procedure.
Awesome. Now, if a baby has a tongue tie, do they tend to have a lip tie and vice versa? Do they only usually have separate or together? How does that usually?
Um, it really depends on the type of tie. I would say, yeah, that's a hard one. Most that have a tongue tie will have a lip tie, and you really have to assess: are babies curling their upper lip in because of their tongue tie, or are they curling their upper lip in because of the lip tie solely? I think it's very, very hard to know. I discussed the pros and cons. Everyone has a frenulum, and whether it's restrictive or not, you really have to just get in there and look at the latch, look at the suck. I sometimes go through the pros and cons of, is this solely a tongue issue or is it a lip tongue issue?
Mhm.
From some of the lecture, they say about 90% that have a tongue tie or lip tie, vice versa. And
Mhm.
the number of times I've released a lip tie without a tongue tie is maybe a handful.
Yeah.
Uh, I can't think of maybe more than five, like truly no tongue tie in the presence of a lip tie. Like flat tongue elevates great with a really thick lip tie. It's pretty rare.
Yeah.
So if there is a tongue tie, there's most likely a lip tie. Um, and and if there is a thick lip tie, there's most likely a tongue. And so, but really, I weigh the pros and cons. Sometimes I'll release tongue ties, and then parents will wait a week or two to see if the lip tie is a factor. And that's a good answer. Or some will say, baby's going through a procedure, the lip tie could be a factor. But let's release both just to play it safe. And in those cases, we'll never know if it was, a factor
Yeah.
or not. But you just really look at how tight it is and make your best judgment.
Awesome. So yeah, so ultimately, after well, I want to talk too about finding a provider, right? So
Sure.
ultimately, doctor, if you're in the Indiana area, obviously going to Princess City Dental Care, and you can check out her website or her Facebook page. Definitely go give her a like on her Facebook page. But there is a lip and tongue tie provider list that we will post as a start. Of course, there's many other amazing providers out there. The only thing we encourage is definitely do some research, join some of the lip and tongue tie Facebook groups, some of the preferred provider groups, just to kind of really research the different providers out there. Some of them are definitely like highly trained in kind of doing this, where others maybe do it here and there, but they're not as, highly skilled. So we just encourage you to really research kind of what provider you're going to. And we'll post a link of a website to go ahead and get started on if you're looking for a provider in your area today. Um, and then, so find your provider, you get your evaluation, there's the two options, of course, laser, which Dr. Polson does, and most of the dental options do. And the other option you have is more like the ENT, right, where they do the clipping.
Sure.
Can you speak at all to the difference between those and which would be better or that kind of thing?
Yeah. So I always tell parents that the, the it's not the tool, it's the provider. And so it's the skill of the provider doing it. It doesn't matter if it's laser, it doesn't matter if it's a scissors, but um, what you want to ask is, do you see babies? How often do you do this? Um, Describe their assessment technique. Um, and you want to make sure that They have the training in it, and they do it often. I've seen some midwives do an amazing job with this. Really, they do. I think of dentists as um, dentists are mouth, teeth, gums, and ENTs are ear, nose, throat. And so dentists are just trained to use lasers and use lasers in the mouth. And so, uh, you know, we're used to working in the mouth. We're used to using lasers, intraoral lasers, where a pediatrician or an ENT just may not be. But they do extra training. They absolutely can be very skilled and very good at what they do.
Awesome. Now, what about, so if they've had a first revision, um, one of our moms on Instagram was asking that her baby had to have a second revision as well. And some of the moms are asking, like, what are your thoughts on why would it need to be revised again? How can we prevent second revisions? Anything about the second revisions?
Yeah, so I will see some people sometimes for a second revision, and the whole math thing is a reason why they may not clip the whole tie. And so a second revision is needed to get the whole amount of knowledge restricting the tongue from moving. Um, the other reason would be is if there might be some scar tissue formation from the revision, and babies heal differently. I do recommend aftercare, and I can explain that and the pros and cons of doing that, and uh, just the way the baby healed or circumstances that are beyond the parent's control could restrict the tongue. And so sometimes a second revision is warranted, but you got to be very careful about what you're trying to gain. And you have to go on symptoms and how the tongue can physically move and how restricted the tongue is, again, whether it's a good idea or not.
Awesome. So yeah, on that note, do you want to kind of talk to us about, I guess, like post-procedural care and things that the mom does after going home and about how long that lasts?
Yeah, absolutely. So there's no research on this. I, some providers started recommending aftercare, and I can tell you from what I see in my practice, when parents blatantly don't do recommended aftercare, or baby gets sick, and we had the flu or the cold, and we didn't have time, we couldn't do the stretches. I see non-optimal healing, and I wouldn't recommend something if I didn't see consistently good results that were of a great fit to the long-term success of healing. But this is the way I explain it. If there's a tight frenulum and I release it, it naturally makes a diamond wound like this. And babies heal so fast. The edges of the wound want to come back together this way or this way. What I recommend is some gentle lifts and sweeps under the tongue and the lip so that the wound that's a diamond shape stays a diamond shape, and you maintain the maximum mobility of your tongue and your lip. That way, if when the wound's healing, any if the scab or any scar tissue starts to form, you're actually massaging and releasing it on a daily basis so that the tongue doesn't get anchored back down and all of your symptoms return.
Awesome. Yeah, I know on a lactation side, we obviously recommend, the different, following the provider, usually pediatric dentists, family dentists, on doing the stretches and also really working on like suck therapy. I think someone's going to post some awesome after exercises and sucking exercises, just really helping baby. That's a lot of times what happens. Sometimes baby will latch like right away, right after. They're kind of still maybe numbed up. Latch is great. And then like 2 days in, mom calls and is like, yeah, baby's not latching or sucking really well.
Sure.
And so ultimately, depending on how long you've had that tie, right, you could ultimately have been never have sucked well, or definitely been 6 weeks of your mouth, the baby's mouth doing this one way, right? And
Right.
so really getting that tongue to pull out, letting baby, some of the things we do is like let baby suck on her thumb. We play tug of war to really get baby moving.
Mhm.
Um, and strengthening that tongue, and also do it with like a pacifier. Also kind of putting pressure on the palate to get baby
Yep.
push up, moving the gum along the gum lines, all these different exercises that again we'll post, but that is why it's so crucial to follow up with your lactation provider after to reassess the latch, work on some sucking exercises, finger feeding. And I think, my practice leads, the biggest thing I've seen is moms, provider fixes it and then like their job in their mind is done, but there's a lot that goes in after to also protecting the milk supply. Because I
Yep.
think moms think, oh, my baby's fixed, so now I breastfeed.
Yep.
But if you are pumping every 2 to 3 hours, you can, most of the time you cannot just switch baby back on this baby that's never properly latched right and cut out all the pumping and expect that your supply is not going to take a dip. So it's really kind of balancing, the pumping, switching baby over and making sure baby's still efficiently transferring. Even though they got corrected, they are not usually now just perfect, no issues. They just now open as wide as they can. Hallelujah. Here we go. And latch perfect transfer right away at the first time.
Yep.
So I think it's really helping moms to understand how crucial it is to protect the milk supply when you're going from revision day to, 2-3 weeks out, however long, while baby's working on regaining the strength. I mean, sometimes, a speech language pathologist is involved, or a cranial facial therapy. Sometimes even more intense therapies are involved later on if baby's really still having some issues, using its oral motor function. So I think, yeah, it's just crucial to kind of understand, there's options. I usually recommend a lot like the SNS. So supplemental nursing, right, where they're using their milk, they're still working on the latch. But at the same time, they're getting the supply that they need. And so again, just super crucial. Moms, definitely reach out to your providers, your lactation providers, because they can really kind of give you, good tips. I mean, I saw a mom actually last week who she was waiting till the baby was like screaming hungry, really, really hungry. And then trying to say, hey, can you work with me and practice latching now? So just kind of the simplest tip of like, hey, let's watch early cues and feed a little bit sooner, or even offer just a little bit of a bottle, half an ounce, and then try at the breast. Now baby's like perfect, but just needed like a little bit of guidance after to kind of get them back on the road of, successful latching and breastfeeding. So.
Yep. Absolutely. I paint the picture of, you know, this is maybe just the beginning and you're going to reach out, maybe relearn how to latch in exactly the ways that you were just describing, relearning how to latch. I, um, I paint a picture of baby catching right away, or this may be a journey where baby has to relearn everything and reach out to your provider to help you reach your breastfeeding goals. Yep.
Perfect. Yeah, exactly. So one of our moms today on Facebook's asking bottle fed babies. The babies that are bottle fed, do
Yeah.
they need revision?
Yeah. So I have guys plenty of babies that are bottle fed, and it's for reasons can't take a bottle, not taking a bottle well, drinking milk out, choking, gagging, reflux, you know, all of the reasons that, a lot of the reasons we described while nursing can affect, a bottle fed baby. I'll remember this was maybe a year and a half, 2 years ago. I don't know. I had a mom who had adopted a baby and had really severe oral restrictions and was struggling to gain weight and was obviously bottle fed because she had adopted the baby as a newborn. And the revision significantly helped the baby. And so, especially if you think there will be speech issues or problems eating solid foods down the road due to the inability to move their tongue, I have seen great things with bottle fed babies. And that's where language pathologists and even some lactation can do feeding therapy to help those struggling babies that are bottle fed. It's a different suck and it's a different skill to be able to uh, teach relearn how to suck from the bottle. So I had great results by doing that. Yep.
Awesome. And then another question that just got asked. So a couple moms have said that their providers had told them that it could stretch over time, like after they saw them in the hospital, and they said not to correct it yet because it can stretch over time. What are your thoughts on that?
Collagen can't stretch. So I learned that a long time ago, ties are made of type 4 collagen. They cannot stretch. You can rip them, but you cannot stretch them. And the max percent stretch you can get from a type 4 collagen is 4%. That's like nothing in the mouth. I mean,
Yeah,
it's nothing. So, um, can babies grow and get bigger and get wider mouths and adapt and just like adapt and learn away? Absolutely. But does that go away? Never. I always say tongue ties, where they're attached, they grow with the tongue. They're there. Lip ties, however, where they attach as the collar goes downward and forward, can migrate up some depending on how thick and where it attaches. And the frenulum will always be there, but it may not have the effect on thing as it did at the beginning.
gotcha. Awesome. Um, and then can you have a good latch, but like the tongue still be off with the suckability? That would be yes, correct? Yeah.
Yeah. Yeah, absolutely. And maybe you can talk about that too. But relearning how to use your new freedom is, um, I mean, some babies adapt very, very well. Like it's an instant fix and they are good to go. It's like they were meant to do that their whole life. The Sometimes babies will still chomp and chew or have a tongue thrust where their tongue goes out and in instead of up, even though they're released. And that's where lactation consultants, chiropractors, myofunctional therapists, speech language pathologists that are trained to work with the tongue can help and relearn and help babies
Dr. Polson?
correctly. Yeah. Am I still there?
Hmm. Can you hear me?
Yeah. Am I still there? Hello? Hi. I'm still there. Hello? Can you hear me?
Hello? Can
Hello?
you hear me? Oh no.
Uh-oh. I think they lost me.
Hello. Sorry, guys. Looks like we had a little technical difficulty. Let's see if Dr. Polson is here. Okay. So I cannot hear or see.
Am I back?
Oh, yay!
I re-got it. Something glitchy happened. So
Okay, yes. So we had a little, no worries. Same here.
okay.
So let's see.
Okay.
Go ahead.
Nope, we're good.
Okay. So Erin, we had kind of talked earlier, so feel free about, she had just asked, can not having a tie, affect speech problems in the future? And so, Dr. Paul kind of told us that ultimately there's no way to really tell. So just really kind of getting the full evaluation, weighing out the pros and cons, and kind of making an educated decision with your provider and as well as the parents of your child on kind of what you feel is best moving forward. Any other questions, guys? This has been really informative. Thank you again, Dr. Polson, for all your time tonight. Let's see, any other questions? Let's see, someone asked. Unfortunately, the biggest thing I've seen tonight, which makes me part sad, is just the misinformation. Mom saying that they received a lot of misinformation. And again, I think, you hit the nail on the head with really researching your provider and making sure you find a good provider. And at the end of the day, you're a mom. So if something doesn't sit well with you, if you've seen one provider, even if they're on some list, right? At the end of the day, if you saw them and you just don't feel right about it, your journey is not where you want it to be, you did not get the results, reach out to more support. Maybe be an IBCLC, an SLP, a speech language pathologist, a chiropractor, another pediatric dentist, an ENT, like whoever that might be. Like, again, don't, sometimes I've seen moms and I'm like the fifth person they've seen, and then they finally get the answer. So your mom, you can hire and fire and, make decisions for your little one. So ultimately, just kind of making sure you're the advocate for them. So don't feel bad about getting a second opinion.
Yeah, absolutely.
We have a mom that's actually going to get a revision tomorrow. Is there anything she wants to know that she should ask?
Okay. It depends on where you're going. I think all the things that we talked about how do they assess and what to expect and their aftercare and and their support system, who they work with, and make sure that seeing an ideal before and after is really important. And depending on the problems that are going on, if what support system is in place for them, and said how comfortable they are, how often they do the procedure, and they just, like you said, they have to feel comfortable, and just ask lots of questions.
Cassie wants to know, does it hurt them super bad?
Yeah, so I always say, babies I haven't had one talk to me yet, but I always feel like I feel it, and I feel like they have innervation, especially in the thin ties that adults do. And to be cry during the procedure, absolutely. Have I had plenty of babies absolutely not cry? Yeah, I kind of prefer to cry so I know they're doing okay. But if you think about the sensory issues with the baby holding open their mouth, the noise of the water, um, I think most will fuss. And, there's laser safety goggles on them. It's not natural. They're not comfortable. They're not in their mom. And my experience, right back to mom, most babies just go ahead right away and nurse and calm down really quick. Can they feel it? I absolutely can. That's why I use the topical numbing gel. I try and get it in just the immediate area so it doesn't affect nursing. I literally just put it right over the tie. I don't let it get into the mouth to affect feeding, but I do what I can for the babies.
Awesome. Yeah. So I think, and Chris said that ultimately, it takes, less than a minute, right? So it's a very quick. And I think at the end of the day, it's kind of like if you, one, have been in pain with latch, baby's getting gas and is colicky and reflex, and you've gone through mastitis and, all these things that last weeks and weeks and weeks for 1 minute of potential. And again, it may not be the fix all. There might be other stuff going on. But, again, you weigh out those pros and cons. And the correction does create so much, release for their mouth to be able to actually, I always tell moms, like, we're asking them to kind of do something they can't do with those ties, right? Like we're asking them to stretch their tongue or open their mouth. And at the end of the day, if we're asking them something we can't do, we're kind of putting them in a punishment situation, where if we do get the correction, then we're now allowing them to be able to do what we want, what we need them to do, the nursing.
Yep.
Awesome. Let's see. Yeah, so a lot of, providers getting told, a lot of moms, Alicia, that, they can stretch. So same with Angela, I guess she was told possibly stretching, Maya. So yeah, definitely, a myth there. And so, really, again, researching your provider and possibly looking into correction. Let's see, any other questions, guys? Timing wise. Okay, well, we answered Riley. Could a lip tie allow good latch, but interfere with sucking ability? Definitely on that one. So again, one of the things that we are giving away to every one of our moms tonight is going to be our breastfeeding starter pack. So as you see here, it will be our adapters, which allow moms to pump directly into the pump. And then when they screw it on right here, so if you have a Medela or Spectra or any of our different pumps, you would screw this right on to your flange on your pump directly into it, and then it snaps right into our bottle holder here. And then you can feed directly. The nice thing about this bottle, it is an active latch nipple. So it's going to be, if you were to pour it, nothing's going to drip out. A baby has to be actively latched onto it to be getting the milk. So breastfeeding friendly. And then you also get a coupon for 40 free pouches. And you'll also be getting a coupon for 50% off our gift set. Which if you take a look here, we're actually going to be giving out one of these tonight. So it's going to come with everything you need to pump, store it in the freezer, thaw it, and warm it up in our warmer, as well as all of your bottles, nipples, and our foodie collection. So we have the ability to prepare baby food, pour it into the pouches, warm it up, and feed it as well. So all of that in this lovely bundle here. We're going to give out to one lucky mom tonight. But in your starter pack that every mom gets, there's a 50% off coupon for that. So definitely we're going to go ahead and pull one of those names. While we do, there is a couple questions on healing. How long does it usually take to heal?
So I recommend the sweeps and stretches that obviously that your provider should show you. You lift the tongue a couple times and sweep underneath is what I recommend. It's got to be quick and very gentle, but effective. And those about 3 weeks until that diamond that's under the tongue is gone. However, what's underneath is not fully healed, I believe, for about 6 weeks. The wound is closed, the wound is gone. Typically, the lip tie, maybe about 2 weeks. Tongue tie, about 3. So.
And so when you kind of notice it, like it usually is kind of white.
Am I still on?
Yes. Can you hear? Oh, no.
Let's see.
It looks like some technical difficulties, but we're so thankful for all of Dr. Paulson's time. Oh, yay.
Yeah.
Third time's charm. No worries. So we're super thankful for all your time tonight. We really appreciate that. If someone wants to post the giveaway winner, I can announce that real quick. And so click the link below. It'll be posted for your free Facebook Live, free starter pack on our Facebook Live tonight. So please, we'd love to give each and every one of you one of our starter packs and one lucky mom our gift set. And if there's any questions that you guys, as you go back and watch this video that we did not get to answer, please feel free to post it below. And myself or one of our IBCLCs will be joining on to answer some, and Dr. Paulson might be around a little bit to maybe even jump on and see if anybody had any questions that we didn't get to answer. But Kristen, can I have a lucky winner for our gift set? So winner for the gift set is Kylie Hirschberger. Kylie on Facebook tonight. So you are a lucky winner of this Twist gift set. So please email into our customer support for your amazing gift set. You can go ahead and start pumping and warming and storing and freezing and all that good stuff. So again, thank you everyone for joining us tonight with Dr. Paulson. I will be back in 2 weeks with Brian the Birth Guy again for our monthly show, which will be the Be Kind to Yourself show on March 18th at 9 p.m. Eastern as well. So again, please like the Princess City Dental Care website from Dr. Paulson. And again, Dr. Paulson, thank you so much for answering all of our questions.
You're welcome. welcome. I hope yeah, I'll hang out it and answer some questions as best I can until the baby wakes up. You know,
Awesome. Sounds good. So definitely share your questions. Dr. Paulson will help. And we'll post amazing links of aftercare and sucking exercises and also preferred providers below.
got
So
it.
thank you guys. Have a wonderful night.
All right.
Bye-bye. Bye,
Bye.
Dr. Paulson.